Medical Intuitive Insights with your host, Dr. Gloria Warren, is a program that presents topics on medical intuition, holistic opportunities outside of mainstream society, and scientific research as applied today. Topics range from online intuitive readings to interviews unveiling alternative healing modalities and discussing them with inspirational leaders. Dr. Warren is the bridge within holistic arts while stressing the balance between the spiritual and physical self. So now, please welcome the host of Medical Intuitive Insights, Dr. Gloria Warren.
What is your body trying to tell you when performance changes? And could erectile dysfunction be an early warning sign of something else? What if ED isn't the problem, but the symptom? Welcome to Medical Intuitive Insights. I'm Dr. Gloria Warren. We're here today discussing the topic that affects millions of men, but is rarely spoken about. And honestly, it's sensitive and depth. Erectile dysfunction, also called ED. ED is not just a physical condition, it's a window into emotional, vascular, hormonal, and psychological health. Today, we will explore the symptoms of ED, potential causes, physical, neurological, emotional, and generational, and the medical and holistic pathways that can restore function, confidence, and connection. You know, in the US, the prevalence of ED is very vast, about 30 million, up to 50 million men, at least, actually, in the US have erectile dysfunction. Yeah, that's a high number. So we need to talk about this. Today, we have Coach Mike here with us to talk. Hello, Coach Mike. How are you?
Hello, how are you? Thanks for having me.
Yeah, he's the perfect person, by the way, because Mike is a somatic sexology instructor. He does body work. He is a hypnosis instructor as well, and many other certifications behind his belt. And I'm just so happy to be able to have you here. You're the perfect person to add to our conversation in this discussion. Thank you for being here in advance.
Thank you for
I
having
was
me.
just talking the prevalence, it's strong and it increases with age. By age 40, believe it or not, by the age of 40, 40% of men have this problem. And by the age 70, 70%. And you can remember those numbers, 40% around 40 and 70% of the men around 70. And in today's world, 70 is not old. So it can be a very emotional problem and state that men actually go through, as well as the women that they're with. In large nationwide, the survey analyzed recently, the ED prevalence remains the highest among older age groups, though men meeting the ED criteria had not sought medical care. That's what we're here today. We're going to try and give you some of those basics that can help you move along. And you can take this information back to your physician or any medical or a coach like Coach Mike to help you through these situations. So why the estimates vary so drastically when you look? You can ask AI, you can go everywhere. And I'm sure everyone can check online in different areas, but why do they vast so differently? It's because some studies classify difficulty achieving or maintaining erection at any time. Others require persistent problems or failures sufficient for satisfactory sexual intercourse. Now, there is no basic measure, I guess, for that situation. And there's nothing universal to measure things in clinical studies, even when they're testing for potential drugs that could help or not. And, it all depends. So age does matter, though. Prevalence, it does increase dramatically as men age. Younger men have much lower ED rates. Of course, 40% at the age of 40, to me, is very sad because that's a lot to go through at that age. I think as you get older, you expect it more in a sense. Maybe that can be adding to it as well, which we're going to discuss in the somatic situation and potential ways to reverse that if that's the problem. That'll be in quarter 3 of the show. So Mike is going to have a lot of things to say there, and I'm really looking forward to that. The underreporting of this situation is drastic. Men don't want to admit that this is a problem, even to their medical professional. They don't seek medical care for the most part, meaning that official diagnosis and data may be understated, as well as the true prevalence of the situation. Health comorbidities, conditions like diabetes, heart disease, hypertension, are common in middle-aged and older men, and it strongly increases the ED risk. And yes, they do actually increase it. So we're here today. Let's remove the stigma and replace it with the understanding. So we'll first go through a few symptoms of erectile dysfunction. And I'm sure if this is your problem, you should most likely understand some of these on this list. So the symptoms may include difficulty achieving an erection, maintaining that erection, reduced sexual desire, softer and shorter lasting erections, anxiety or stress around intimacy. These symptoms are not a reflection of masculinity or worth per se. They are psychological and emotional signals, as well as physical signals may be the case. Quick educational note, though, I wanted to mention this. The penis is like a barometer. It reflects cardiovascular, neurological, psychological health in real time. So if this is your problem, you may have something else going on that you need to have investigated. So how are you? You were actually a counselor for people in the somatic. How did you say that? Somatic sexual.
It's somatic sexology.
Can you explain to people what that is?
Yeah, somatic sexology. Soma has to do with the body. So the word somatic it refers to anything that happens in the body. Sexology is the science of sex, simply put. When you combine the science behind our sexual performance, you have to include some of the things that will trigger physiological responses. And you're absolutely right when you talk about the emotional stress and anxiety that is associated with it. And
Right. It's like a loop, isn't it?
right,
Sometimes, I
absolutely.
mean, I'm sure many men out there can attest to the fact that if you're psychologically under stress and then you can't have an erection, and let's say your wife, she gets upset or not, who knows, but maybe it upsets you more, and then that creates more tension and more of a psychological situation. And this is why we're here today. We want to stop that cycle. We want to throw some things out there for you. We want to give you a book, a guidebook per se, on different things that are out there to help diminish this problem, and also look at some of the, not just the symptoms, but the causes of ED outside of even psychological causes. There are many other causes. And we're going to probably touch base on that in the next section right after our break. But right now, it's more about what we're talking about, the symptoms. The symptoms are, potential causes of erectile dysfunction is, you could have an inhibition of vascular blood flow that actually goes into the penis. And I mean, that's an obvious, and that could be from high cholesterol. It could be high blood pressure, diabetes, peripheral artery disease, even. There's many things in that, or even an injury in the area. I know that a lot of people are starting to notice that they can get help for an injury in that area, which it's a good thing for them, because then they can get past that in their life and they can resume life as normal, which is what we all hope for. So the cardiovascular disease is very prominent. And then neurological causes, you can have any injury on your spine, head injuries, nerve damage, basically. You can have a condition like multiple sclerosis or Parkinson's disease, perhaps a stroke in the brain. Pelvic or prostate surgery, can also contribute, because whenever they do surgery in that area, they're going to be cutting capillaries and interrupting the natural level of blood flow going to those areas. So that's something to consider as well. And maybe that's something that can be regained. Maybe it isn't. That's something that would need to be investigated. And then there's hormonal causes like low testosterone and thyroid imbalance, elevated prolactin levels. But what I'm trying to get at here is hormones are the body's messengers. And when messaging breaks down, desire, performance can shift. And you have to have those hormones to get them back again. So that's something that you would have to see your medical professional or your holistic professional, who you prefer. Psychological and emotional causes, of course, we discussed that a little bit, and chronic stress, anxiety, depression, performance anxiety itself, which creates that loop, pornography-induced desensitization. I know that's a very odd situation, but if you're constantly watching pornography, eventually it's not going to have the effects on your brain and self as it used to. And the brain itself is the largest sexual organ of the body. If the mind is overwhelmed, the body follows. So there's also medication causes in related to ED and antidepressants. Oh my gosh, I'm finding that it is a big cause of ED. Blood pressure medications, if you're taking too high of a dose, that's one of the signs, so you may want to talk to your cardiologist and see what's going on with your blood pressure and your medication. Antihistamines, that also desensitizes your body from having a reaction. And if you lower that reaction time, and it takes too long, you may lose interest or whatever. But side effects matter, and often medication adjustments can solve that issue. Lifestyle factors also have something to do with that. And we're going to get back to that in just a moment. We're going to take a commercial break. I'm Gloria Warren. This is Medical Intuitive Insights with Coach Mike. And our topic today, erectile dysfunction. You don't want to go. You won't want to miss this. We'll be right back.
Mike Zorek, a three-time California state champion in Greco-Roman wrestling at 114 pounds. Mike, blind since birth, was born in Hartford, Connecticut. He was a six-time national placer, including 2 seconds, 2/3, and 2/4. He also won the Veterans Folk-Style Wrestling twice at 152 pounds. In all these tournaments, he was the only blind competitor. Nancy Zorek, a creative spirit whose talents have taken her to the stage and into galleries and exhibitions in several states. Her father, a commercial artist who shared his instruments with his daughter and helped her fine-tune her natural abilities, influenced her decision to follow in his footsteps. Ms. Zorek has enjoyed a fruitful career doing what she loves. Listen Saturday mornings at 12 Eastern for the Nancy and Mike Show for heartwarming stories and interesting talk.
Are you struggling to care for elderly parents or a spouse? Do you wonder if being a caregiver is making you sick? Are you worried about taking time off work to care for elderly parents and balance work, life, and caregiving? Has caregiving become exhausting and emotionally draining? Are you an aging adult who wants to remain independent, but you're not sure how? I'm Pamela D. Wilson. Join me for the Caring Generation radio show for caregivers and aging adults, Wednesday evenings, 6 Pacific, 7 Mountain, 8 Central, and 9 Eastern, where I answer these questions and share tips for managing stress, family relationships, health, well-being, and more. Podcasts and transcripts of the Caring Generation are on my website, PamelaDWilson.com, plus my caregiving library, online caregiver support programs, and programs for corporations interested in supporting working caregivers. Help, hope, and support for caregivers is here on the Caring Generation and PamelaDWilson.com.
Welcome back to Medical Intuitive Insights. Before the break, we explored some of the symptoms of ED and some of the causes of ED as well. Now let's uncover further causes, the physical, emotional, and even generational influences. We were in the middle of giving some of the causes, and we got to lifestyle factors. So erectile dysfunction can, more commonly known as ED, can actually be caused from smoking or alcohol use, sedentary hours, and poor nutrition even. So the penis is a vascular organ. It reflects lifestyle instantly and honestly. Doesn't lie. So that's something to be considered as well. Um, Generational trauma. Now, I think that a lot of people are a little confused with that. So, generational trauma plus masculinity condition. Men often inherit silent beliefs. I must be strong. I must never fail. I can't ask for help. And this is a common thing. I mean, can you imagine, Coach Mike, how many people how many men think that they have to be the strong ones and they can never fail or ask for help?
Yeah, these are adopted attitudes that at some point in our life we accept as fact and the way to be. You know, so many of us don't realize that there is a point in our life when we can actually revisit and reevaluate the things that we grew up learning and make decisions for ourselves about what works and what is worth continuing to believe and what beliefs are limiting us. So yeah, those attitudes are something to be considered as well. Very important.
Right, like, you men, I mean, you are the soldiers of the world. You must never fail. You must always win, and you cannot ask people for help because you are the soldiers and you should know everything you need to know and to move forward. And, I just find that that's a shame because it's such an emotional situation, ED. And I cannot me as a woman, I think I cannot imagine what a man may or may not go through. I think some of them is, oh, whatever, I'll get it next time, and that's great. But
Yeah,
some of them, they don't do that. Their brain gets on the hamster wheel. You know what I mean? And it's like,
absolutely.
oh
Yeah.
yeah, this is, and it keeps going around and around and around. And this is what I tell everyone too. When you're in that psychological loop of any kind, whether it be from ED or anything else in your life, I think especially like sometimes you get depressed and you keep this hamster wheel just keeps going around and around. You need to just remember one simple thing: change your mind. You can get off that hamster wheel at any given time. You have that power. You have that right, and you can if you'd like. If you'd like, we are going to give you some more information that is fantastic. So, actually, symptoms can be saying like, please notice me, take a breath if you want to know what you can do. Stay it's so many things that people can do medically and holistically. So, in this quarter, in this segment, I'm going to talk to you about some of the medical and holistic complementary resolutions. Remember, next quarter, we're going to be talking to Coach Mike about the somatic sexology that can actually contribute to moving on in your life and hoping to get an erection if there isn't a physical problem, like an accident or things that we mentioned in the beginning. Keep in mind that sometimes it's really a good idea to get your medical um, physician or professional involved that you choose. And self-sustainability means sustaining yourself. So you make the decisions for yourself as well. Don't expect everyone to know everything to make you 100% better again. It's not going to happen. It's got to be through you. And you can use this information towards your health and seek out the correct medical or professional that you want to seek out to help you. And that's what's important because that's going to help you psychologically getting better as well.
Mhm. Yeah.
So, interventions, medical interventions. There's different types of things. You know what? I'm going to do something a little different here. Let's look at medical interventions for ED. Let's see what everybody's into AI nowadays, and let's see that you can use some of this for your information. Medical interventions. Oh, they give you a whole list. Is that nice? You saw a lot of these things I've seen actually are the same ones that I'm going to talk about here. So there's Viagra, there's Cialis, there's prescription medications. Um, Levitra, Sendra, and various types of medications. They're only effective 70 to 85%, which is fantastic. I mean, they do help, but there's a lot of drawbacks to them too. So that's something you need to talk with your doctor about, the drawbacks, because they can conflict with your own personal situation and perhaps even your medications you're taking. So please, heed that label and know that you need to talk to people about it. See, it can't be used with nitrates, may cause flushing, headaches, can cause a lot of other more dangerous things. There's testosterone replacement, so such as topical gels, intramuscular injections, pellets, improves libido, energy, erectile strength, limitations. It does not help if hormones are normal. So there are things that may need to be considered with each one of these things, and that's where those professionals come in handy. Second line interventions, they have vacuum devices, penile injection therapy. It's only 85 to 90% effective, but that's a quite high percentage. Urethral suppository, they call it Muse. It's alprostatal microsuppository. It's inserted into the urethra. Not sure if you're up to that or not. It's all depends. Third line interventions, penile implants. I'm sure you've heard of these for the last like 30, 40, 50 years. Inflatable penile prosthesis, malleable rods. There's different things that they can use, and shockwave therapy, vascular regeneration focused medical procedures. Like I said, if you've had surgery down in that area, it is possible to regain the circulation back to those areas, and that's a process. And that's something that your professional may actually be able to help explain to you. If you need to call me on it, you're more than welcome. 715-892-7500, and I'll explain that to you. The P shot, or known as PRP injections, uses platelets rich in plasma to improve tissue healing. So if you have an injury, there are things that can help you with that. Stem cell therapies actually come to mind on that one as well. They are experimental, but they may be something you would want to do. That's between you and your medical professional. Urologists can do checks with different things. They can do testosterone and other hormone blood tests. Check your cholesterol. If your cholesterol is too high, there's not enough oxygen flow coming through those vascular vessels to get to the areas that it needs to be. Blood sugar, diabetes does inhibit erectile function. So, you may think people are like, oh, there's so many people with diabetes, don't worry about it. No. you may need an ultrasound to check for plaque or your vascular system, cardiovascular screening, different things of that nature. There's just so much there, though, that needs to be looked at. Let's see here. So the hormone testing, low testosterone, for instance, it's natural for a man over 40, anytime, could be at 50, 60. Nobody's exactly the same. So when the testosterone starts to get low, that takes a blood test. And so you need to see a medical professional to get the blood test. And then you can have that checked, and maybe you can get on supplements. And that there's something that the doctor will actually need to keep track of, because after all, you can get too much hormone in your system, and you don't want that. There are some negative effects, and you don't want that to happen. So there's thyroid correction. Thyroid problems can actually cause erectile dysfunction, and they can give you maybe your TSH is way too high or way too low, and it's interfering with a normal natural erection. So that's something that maybe can be treated with medication. Prolactin regulation, regulating your prolactin in your system. Like I said, vacuum pumps, injections, underlying medical conditions. Cholesterol, something simple. Like I said, cholesterol I think that's one of the really high things nowadays that is interfering with erections in some end. If your cholesterol is high, you can have a problem, especially as you're getting older. So it's something to keep checking. So now you're probably asking, well, what are the complementary or holistic options? And that's where we come in also. Here's with Mike. Holistic plus complementary therapies, herbal nutritional support, is something to consider, like L-arginine and citrulline, and it improves the nitric oxide and the blood flow to the penis. So that's important. Ginseng enhances the physical stamina and circulation. Wonderful, wonderful. I get mine, my little vials from, I order them online. I get a whole box of 30, and they're there if I need them for my vascular flow anywhere in my body. Oh, my elbow is swollen. I need a little ginseng, get that vascular flow, maybe a little turmeric, take down some of that swelling, but ginseng also works in the um, penile area. So there's maca root as well. It supports libido and hormone balance. Ashwagandha lowers stress hormones in men and women. So that is wonderful, ashwagandha. It's always on my list. And omega-3s improve vascular health. So that's just a few things that we're going to discuss even further: breath work, nervous system reset, and then we'll get into the somatic sexology. So that will be a phenomenal thing when we come back after our commercial break. So don't go away. We'll be right back.
Master of words, powerful player. What life-changing words can Dr. Janet Smith Warfield pull out of her magical toolbox that just might mysteriously open a door you never knew was there? A door to free yourself from fear forever. Transform your rage into right action. Release your guilt. Position you into a life of freedom, purpose, passion, power, and peace. All quite suddenly, unexpectedly, and almost miraculously, with no effort on your part. Join Dr. Janet on Dancing with Words, Dancing with Wisdom, as she and her guests show you how words map our experiences, immersing you in a sound bath that relaxes your muscles, opens your mind, and supports you in co-creating your extraordinary life. Author, radio show host, and coach John M. Hawkins reveals strategies to help gain perspective, build confidence, find clarity, achieve goals. John M. Hawkins' new book, Coached to Greatness: Unlock Your Full Potential with Limitless Growth, published by iUniverse. Hawkins reveals strategies to help readers accomplish more. He believes the book can coach them to greatness. Hawkins says that the best athletes get to the top of their sport with the help of coaches, mentors, and others. He shares guidance that helps readers reflect on what motivates them, rediscover and assess their core values, philosophies, and competencies, find settings that allow them to be the most productive, and track their progress towards accomplishing goals.
Welcome back to Medical Intuitive Insights. I'm your host, Dr. Gloria Warren. We have Coach Mike here. Our topic today is erectile dysfunction, and we've already discussed some of the statistics, the symptoms, some medical interventions. We're working on the holistic complementary alternative scenario right now. So nutrition, by the way, I didn't mention that before, and it is really important if you're having that problem to have watch what you eat, okay? Don't eat junk food, fried foods, and things like that. Talk to your doctor about that as well, or any medical professional you feel fit. So breath work and nervous system reset. This is interesting. So diaphragmatic breathing to increase pelvic flow. Pelvic floor relaxation exercises. I think this is really important. I used to do this with some of my clients when we used to talk. I'd have the husband and wife come in and we talk about this and actually have them sit there for a minute, and I'd put them through a meditative practice to help them relax the pelvic floor. It's wonderful. HRV boosting breath patterns or performance anxiety. Doing patterns with your breathing can help your brain take the thoughts out of what you're trying to do and put it into a different place. So it takes it more out of the id this is what I was talking to Coach Mike about. It takes your thoughts out of your, it takes your thoughts out of your ego. You know, you're today here, this person that you are in this world and everything, and puts it into your id, and into makes you help relax in your id and be one with yourself and your soul and that sort of thing. So psychological therapy is another area. I'm going to stop there for a minute. I want Coach Mike to talk about what he knows, and he's an expert in, is somatic sexology. So you want to explain that one more time, just so that if we have new viewers on, they know what we're talking about.
Sure, absolutely. So there is what is called somatic sexology, which has to do with the science of sex and how it relates to your body, your physiological self. Um, Dr. Peter Levine has done countless research and written several books on the topic of somatic experiencing. And he has developed some techniques that allow us to inquire of our body where we're holding traumatic memories and how those traumatic memories can influence our physical performance, generally speaking, all of our health. People with PTSD, people that have other traumatic experiences in their life, um, can recall these instances in a way that will inhibit their body's natural performance, production of hormones, blood flow, and all of that. Studies have shown that our memory of traumatic events can exacerbate uh, ongoing illness, chronic illness. Even acute illness can develop into a chronic illness if we don't let go of the memory that caused it. So, and it goes on and on with respect to, uh, the somatic part of it. Somatic sexology is very, very helpful in helping people to reclaim their performance and their peace of mind with regard to general health. And yet there are people who find it very difficult to even go there. In my research, I've been doing research with hypnosis and somatic healing for several years now. Hypnosomatic sexology takes it another level deeper. And I recommend that if you're going to do any kind of hypnosis, any kind of somatic work, you want to do it with the supervision of your medical provider. It's worth seeking out a medical provider that you are comfortable with, that you can say anything to, that will support you in your health journey. There are countless osteopathic doctors who will treat you in a holistic way, and give you. I want to call it couture advice, tailored to your specific needs. But it's a matter of being open and forthcoming with your medical provider so that they can rule out any other conditions that may be existing and work with you to address all of those conditions and find the best alternative for you. What hypnosomatics does is it allows the body to respond in a better way, incorporating the parasympathetic nervous system and as well as the sympathetic nervous system. You want to remember the sympathetic nervous system is where our stress hormones are produced and our reaction to stress. The parasympathetic nervous system allows us to be at peace, if you will. So you can remember sympathetic starts with an S. That's the stress hormones. Parasympathetic peace gives you peace.
Oh, nice. I like that correlation there. That makes it easier to remember.
Remember,
Thank you for
yeah.
that.
And what happens a lot of times, and I simplify this as much as possible for people. We tend to commandeer the functions of the unconscious mind. The unconscious mind's purpose is to heal our body, to protect our body, to um, protect our body against memories as well. So when a memory is inhibiting our physical performance, sometimes we need give our mind a little bit of help and help it to relax a little bit so that
Have
those
grace
memories
for
come.
yourself.
Mhm. That's
Yeah.
right. And allow ourselves to release those old memories. So hypnosis can help a person to relax. It'll
Mhm.
help the body to relax. It'll also help the mind to relax so that the memories that we are ready to let go of and work through can surface and we can deal with them in a way that is conducive to the healing that we want. I remember a story. This is a true story, and this has affected me through most of my life. But I was born. I was the runt of the family. I was born in a small kid. I only weighed 67 pounds. Many people have heard this story before, but 67 pounds when I started high school. So if you can imagine, I was like an 8-year-old child, the size of an 8-year-old child in high school. I graduated weighing maybe 78 pounds,
Oh,
and
wow.
I was under 5 feet tall. I was young for my age. My sister was 2 years younger than me, but people thought she was my older sister. Uh, for a while, they thought we were twins. We were both the same size. And my mom was my biggest supporter. She would say, "You need," and I had insomnia to boot. My mom would say, "You need to sleep so you can grow. Just remember, if you don't sleep, you're not going to grow. So get to bed, go to sleep, say your prayers." And I would lay there thinking, if I don't go to sleep, I'm not going to go grow. Oh my goodness! For decades, I had this thing with insomnia. It wasn't until I reached my 60s. This is more than 10 years ago. Reached my 60s that I found a way to put myself to sleep. And it took 60 some years to cure my insomnia. What was happening was a self fulfilling prophecy. In my mind, I was telling myself I couldn't sleep and I wouldn't grow, and I couldn't sleep and I wouldn't grow. And all of this together created such anxiety that I was not able to rest. My
Right, right.
um, and it wasn't
You
until
just opened a whole plethora of things in my mind, actually. It's like, this is one thing that I never really considered, but that could be a huge problem, just with what happened when you were being told as a child. It wasn't something that was like in a war area with PTSD, but those little tiny comments, the long-lasting effects on our minds.
in the way we interpret them too. My,
Mhm.
my mom's advice was done with very good intention, and she was my biggest supporter, as I said. And yet, I had a way of interpreting things that was self-defeating. So, and that's one of the things that led me to study hypnosis in the first place was how my limiting beliefs and things like that could actually prevent me from achieving what I wanted to achieve in life. Hypnosomatics allows your body to be healed by the mind and vice versa. And I tell people when they ask me what I do, I say I hypnotize the body and massage the mind so that you can
Hmm.
work together. I do body work as well. I do body massage and hypnosis, and I call it hypnosage. What that does, it gives people a boost, a way of allowing the body and the mind to work together to relax each other. It creates a
Wow.
mutual form of relaxation. And in doing that, we can actually imagine the hormonal flow regenerating itself. If you imagine in your mind the blood flowing throughout your body, guess what's going to happen? The blood flow is going to begin to be enhanced because of
And
your
yeah.
ability. Um, my mentor, one of my mentors, his name is Stefan Schafeitel. he wrote a book. He and his wife Shay wrote a book called um, Master Your Mind Power. And in that book, he talks about how he healed his eye by thinking about healing his eye. He had been hit in the temple with a golf ball on the golf course, and it shattered the eye. The doctor said he was going to lose his eye and that he should have it removed, but he didn't. He took the other route. You got to get the book. He explains it. He narrates it himself. He explains it so well. But he actually healed his eye 100%. And he said,
wonderful.
it's even better than his other eye that he didn't do any work with. So
Right.
hypnosomatics is about using your mind and using your brain to heal your body. And
Right.
so if it can heal someone's eye, think of what else it can heal. It can heal every other part of your body. But it comes with a cost. And the cost is that you examine your belief system, that you take responsibility for your thoughts.
Hold that thought on the
Yeah.
belief system. We're talking with Coach Mike on the somatic sexology and hypnosomatic sexology, which can be applied for erectile dysfunction. They are the
Absolutely.
interdisciplinary approaches combining sex education, body work, and therapeutic techniques through the mind-body connection, embodiment, and awareness, experimental learning. Practitioners may use these techniques like such sexological body work, genital mapping, scar tissue remediation, and many other types of things to assist people through getting over erectile dysfunction if that's where they are at that time. So you are watching Medical Intuitive Insights. Topic today is erectile dysfunction. And don't go away. We have more for you. Biblical scenarios that are actually mentioning things that can be applied here. So please don't go away. We'll be right back.
Are you struggling to care for elderly parents or a spouse? Do you wonder if being a caregiver is making you sick? Are you worried about taking time off work to care for elderly parents and balance work, life, and caregiving? Has caregiving become exhausting and emotionally draining? Are you an aging adult who wants to remain independent, but you're not sure how? I'm Pamela D. Wilson. Join me for the Caring Generation radio show for caregivers and aging adults, Wednesday evenings, 6 Pacific, 7 Mountain, 8 Central, and 9 Eastern, where I answer these questions and share tips for managing stress, family relationships, health, well-being, and more. Podcasts and transcripts of the Caring Generation are on my website, PamelaDWilson.com, plus my caregiving library, online caregiver support programs, and programs for corporations interested in supporting working caregivers. Help, hope, and support for caregivers is here on the Caring Generation and PamelaDWilson.com.
Master of words, powerful player. What life-changing words can Dr. Janet Smith Warfield pull out of her magical toolbox that just might mysteriously open a door you never knew was there? A door to free yourself from fear forever. Transform your rage into right action. Release your guilt. Position you into a life of freedom, purpose, passion, power, and peace. All quite suddenly, unexpectedly, and almost miraculously, with no effort on your part. Join Dr. Janet on Dancing with Words, Dancing with Wisdom, as she and her guests show you how words map our experiences, immersing you in a sound bath that relaxes your muscles, opens your mind, and supports you in co-creating your extraordinary life.
Erectile dysfunction is not failure. It's a signal that something in the body, mind, or spirit needs attention. When men learn to listen to their bodies with compassion and grace rather than shame, healing becomes possible. With medical care, emotional support, and integrative practices, ED is treatable and reversible. And hopefully, if you will see a practitioner, and that will help you. Coach Mike, you had mentioned to me something at one of our breaks about biblical uh, sayings and things in the Bible that help support our goals here. Could you, reiterate that for the audience?
Yes, you mentioned a little earlier in the show um, about what pornography does to help stimulate the imagination, which is key, which is a really important part of our performance in everyday life. I have a very strong Christian background. I have a very extensive background in Bible theory. Um, in the book of Solomon, Songs of Solomon, chapter 4, it gives
Mm,
examples of language, erotic language that have been used as in metaphorical ways to help stimulate the imagination and to help reclaim the eroticism in our lives. And this is something that is to be regarded as sacred and viable and actually blessed by God. So, if you don't mind, I can read a couple of
oh,
examples.
please, by all means.
So, as far as textual imagery, these are verses 1 through 7 in the Songs of Solomon, King James Bible. It says, "Your eyes are doves behind your veil.
Mm,
Your hair is like a flock of goats descending from Mount Gilead. Your teeth are like a flock of shorn ewes. Your breasts are like two fawns, twins of a gazelle." These are metaphors that if we decided that we wanted to uh, use our imagination, it's better than porn because it causes us to find the holistic, the organic way to stimulate the blood flow in our body, stimulate our mind, to turn us on, so to speak. Um, when you use metaphors like your eyes are like doves, suggesting innocence, gentleness, erotic vulnerability, these are all things that are meant to be stimulating for us. And you know, one of the problems that we have as men with regards to shame and mental and emotional blocks in our performance has to do with that decision and how we handle uh, guilt and shame. Shame is an attitude about guilt, and sometimes we assume guilt that isn't ours. We sometimes allow ourselves to have an attitude of shame where we don't perform to our ability, and it
mhm.
creates a self-fulfilling prophecy again, and another cycle that we're not that and a message that says that we're not worthy of what we're seeking. uh the Bible says that we're, and I don't want to dwell on the subject too much, but there are every kind of answer in the Bible that you want, and it says that we are fearfully and wonderfully made. Everything we need to heal ourselves is in our body. We have an
Right.
immune system that was meant to combat and protect us from
Yeah.
external offense. So it's a valuable tool, and if you're looking, it's very easy nowadays to become hooked on things that are there to help us, but you can always go back to the organic and to the original and revive that,
Hmm.
because it goes a long way when even in general health. If your gut is healthy, you can rely on your cravings. If it's
Right.
not,
Right.
you can't.
So
So, Songs of Solomon.
I love it. ED is treatable, often reversible. We even get clues in the Bible about erectile dysfunction. Coach Mike, can you let people know how to get a hold of you and maybe a few little information on those? I think you said you were having a men's course or something coming up.
Yes, it's in the making. We're going to be doing a workshop called Reclaiming Erotic Intelligence Through Breath, Body, and Choice. And
What a
it's
perfect thing for this situation.
right.
Really, that is wonderful.
Yeah, so there are coincidences. But the thing is, yeah, you can get a hold of me by going to olcp.life and follow the prompts. Make an appointment for a free consultation, and we'll talk about whatever is bothering you or answer any questions that you might have for yourself or for a loved one. That's olcp.life. You can also reach me at 774-519-5406 and get you started.
I thank you so much for being here. I think you were the perfect compliment to this whole show today, and I do appreciate that. On the other note, we are inviting a few open-hearted individuals to receive on-air holistic insight and spiritual healing free of charge here. Flash mini reading, a medical intuitive mini reading like we have had before. We are in the middle of our men's series. We have one more week, which is prostate cancer, which I will be doing this coming week. So after that, we are going to continue our flash mini readings. Obviously, on these shows, it's hard to want people to expose themselves to a whole audience of the world. So we will go back to our mini readings when we're finished with the prostate cancer show next week. If you'd like that flash mini reading on a different show after that, please, by all means, call me 715-892-7500. You don't need to reveal your identity, and it's free of charge here rather than having to pay. So if you'd like a full reading, contact me as well, 715-892-7500 at the end. The next Life Connect retreat is second week in December. You can contact me for that. Clinicians, I'd like to leave you with a few thoughts. Are we recognizing erectile dysfunction as a cardiovascular red flag? What underlying pathology is erection revealing? Are we treating the symptom or missing the symptom? Thank you for joining me on this journey. Until next time, may your body speak clearly, may your mind rest peacefully, and may your heart stay connected. God bless all my viewers, and there for the grace of God go I. See you next time.
This has been Medical Intuitive Insights with host Dr. Gloria Warren. Tune in each week as Gloria shares over 40 years of experience and yearns to provide knowledge derived from intuition and research. Wednesdays, 2 p.m. Eastern.